my name is Quentin, I'm a local GP, and this is going to be a video on health and wellness. So if that's of no interest, then please just stop watching now. My usual disclaimers: I'm not a pandemic specialist or a virologist. I'm a GP, and the implication of that is I deal with relatively chronic, complicated problems every day. And I think what we're facing now is a chronic, complicated problem. So I have a fairly simple system that I use in my practice, and your local GP probably has something similar, whether it's visual or just in their head, but we all have a system on how to deal with complexity. I've got a system that I use where I help a patient draw a pie diagram, and I'm going to quickly show you that because it's something you can do at home. You don't need much, you only need a piece of paper and a pen and maybe a little bit of honesty, and you can do it yourself. So I'm going to use the infamous whiteboard, I'm sorry, but have a look, see if this works for you. It's one simple method, there's a lot of them out there, but I'm going to just quickly show you what I do in the practice on a daily basis. So firstly, we have this overwhelming problem right now. We're all fighting this war. It's on the news all the time. It's COVID-19. It's the war on this virus, right? I think we should probably try and put that in perspective. Like I said in a couple of previous videos, most of us are going to be okay through this. 80% of people will be fine. A small number will get sick, and a smaller number will get very sick. But yet it's affecting all of our lives, and that's part of the frustration. It's affecting the economy. People are losing jobs. We're all sitting at home in self-isolation. We cannot socialize. We cannot go out. We cannot do the things we love to do. So we all are suffering a sense of loss, and we experience that in different ways. There's no one explanation for everybody, but there's a sense of loss. There's a bit of a sense of fear of the uncertainty. We now know we're in lockdown for at least 3 months, probably 6 months. Who knows what happens after that? We really just don't know. So is this really a fight on a virus? I don't know. I'm going to probably argue that that's not correct. I think we're fighting maybe change or uncertainty. So first step is, if you're going to do something like this, try and figure out exactly what the problem is. I get patients coming in saying, I'm tired, I'm tired, I'm run down. And when you start breaking it down, there's often a reason, whether it's sleep practices or whether it's stress or whether it's a medical problem. But if you start breaking it down, you can then actually manage the problem, right? So right now, I'm going to call our problem the fear of change or uncertainty. And what I'm going to do is I'm going to try and break it down. So what's happening in my life right now? Yes, stress is a big factor in my life. And there's various reasons for my stress, and there's various reasons for someone else's stress, right? But that is a problem that we're dealing with right now. What's another problem? Another problem is sleep. For me, I'm somebody that needs a fair amount of sleep, and lately I've had a lack of sleep for various reasons. Diet, nutrition, whatever you want to call it. Exercise has been limited. I'm someone that trains relatively frequently, but because of various reasons, that's been a problem. Relationships have been affected because we cannot socialize as normal. Time constraints, social isolation, all the obvious reasons. Medical. Many people have medical problems which are now exacerbated or not managed as well, or they have uncertainty. I'm asthmatic. Is this virus a bigger problem for me or not? I don't know. There's no evidence of that, but I truly don't know the answer. And then a big part of why I'm doing this is just that sense of community. We're on the Central Coast. We're here for each other. And if we can get through this stronger, we will end up being a stronger community at the end. So number one, try and identify the actual problem, try and identify the various components of the problem, and then just break it all down in a pie, right? And what you want to do with this pie, I say pizza to the teenagers to try and sound cool, but that never works. So anyway, make it a pie. Break it down and then start giving a relative weight to all these different aspects. So what is the number one thing that's bothering you right now? For me, that's probably stress. So I'm going to make that 20%, or whether you want to give it a percentage or a number out of 10 or whatever you want to do. That is check for you. Okay, so 20%. Sleep, probably for me another 20%. Nutrition, maybe 10%. Exercise, maybe 10%. Relationships, maybe 20%. Whatever it is. Keep on going and break that down. And these, unfortunately, at the moment, what I've done is I've done all the negatives in my life right now. The uncertainty, the stress, the medical issues, the effects on our community. It's all doom and gloom. It's all negative, right? But what we can do, and that's what I try and teach patients, is what is in my control? What can I try and figure out how to turn these into positives? So try and start thinking positively, and then take stress as something in isolation and go, okay, what are the actual causes of my stress? Clearly there's uncertainty, there's changes at work, there's changes at home. What can I do? What's in my control to actually start making some of those changes into positives so that it's not all negative? What can I do about my sleep? So break sleep down as an individual component. And I can do talks on each one of these because they're all extremely important in our general sense of health and well-being. So my sleep habits have changed significantly over the past couple of weeks. What can I do today, tomorrow, the next day to start improving on my sleep? And I probably will post videos on these separate components because there's a lot of information that I can't do in one video. But sleep is crucial for our general well-being. It's very important for mental health. What can I do about my nutrition, my diet? What can I do about exercise? Not only are these different parts of the same problem, but they're all intricately related because your exercise, daily exercise, affects your sleep patterns. Your sleep patterns affects the types of food you choose to eat, which affects your weight, and that affects your mood and your stress levels, and it's all related. So if you start really breaking it down and go, what can I do about my diet today so that I eat better today or tomorrow or the next day? And what are the healthy foods and what are the effects? And again, I'll do various talks on these topics if there's a need. So, give me a thumbs up or whatever you want if you decide that you want to hear more. At the end of the day, if you break it down, there's a lot within our control. Number one, yes, there's an overwhelming problem. We've had a change in our lifestyles. There's a lot that we can do to change our reaction to all of this. Try and break down what's negative in your life right now. Take a piece of paper, draw a circle, and just start writing down the things that are annoying or irritating or worrying. And then start thinking about those individually. What can I do to change point 1, point 2, point 3? This is not going to change the coronavirus. It's not going to change what's happening on the Central Coast. It's going to change your experience. It's going to possibly change the outcome, but it's going to change your experience through all of this. So if you can get through this more positively, you can get through this more resilient, stronger, then maybe you'll look back at this time of your life, whether it was 3 months or 6 months or longer, and go, you know what, that was a really tough time, but for these and these and these reasons, we pulled through it okay. So give me comments if you think there's value in this. I'm happy to elaborate. This is what I do. This is what GPs do. Yes, we manage the complex medical problems and we manage with medications, but there's a lot more to it than just that. So stay safe. Well done so far. I think I posted a fairly confronting video about, I think, 10 days ago now. I apologize for that, but at the time I thought it was necessary. It was before the social isolation became a buzzword or before it was implemented. And there's been a huge change that everything is different now and people are doing what they have to do. So amazing job so far. Let's work through this as a community. Let's get each other through this positively, and let's try and look back at this and see the positives in the change as well. So take care, stay safe, stay home.